The hard part for me is over. Getting that first video done was very challenging, but I got it done, and I hope that you've gotten over the hard part and made the decision to seek help for the chronic wound that you're dealing with or the chronic condition that you're dealing with. So I wanted to jump right into some types of wounds that people often suffer that are known to be chronic wounds or hard to heal wounds, as they're also called. And these again can be very, very debilitating in your life. They really change your life. Your mobility is down, you don't feel well. It's expensive, doctor's appointments, you have to go all over the place seeing different doctors, and no one really seems to have an answer. A lot of times there's not a good plan in place for how we're going to deal with that chronic condition. So that's what I want to talk to you about, as well as the different types. So you may have what's known as an arterial, excuse me, an arterial compromise ulcer. So this comes from some sort of arterial occlusion or arterial dysfunction. It can be due to disease, it can be due to traumatic injury, it can be due to a surgical procedure or some other type of trauma. And then you have your venous stasis ulcer. This comes from the breakdown of the valves inside of your veins that return blood to the heart. Those valves allow, when they break down, they allow the non-oxygenated or deoxygenated blood to pool in the lower extremities, and without oxygenated blood, then the surrounding tissue starts to break down, and you end up with open wounds known as venous stasis ulcers. Radiation injury. So if you've received radiation for cancer, you may acutely or chronically come across a wound, and these can manifest as skin and tissue wounds that you can see, but they also manifest as wounds inside the bladder or inside the colon. And these wounds are very difficult to heal because we can't touch them and debride them and put lotions and potions and skin substitutes on them. The only thing that can heal these is to revascularize them so that your body can deliver the oxygen that's necessary for that tissue to heal. And so we're able to do that. Skin tears, we know as we age, our skin starts to get a little weaker, and it doesn't take much. The slightest little bump against something can peel off a layer or two or three of skin and leaving an open wound, and then those wounds sometimes can be difficult to heal. And post-surgical wounds, I mentioned earlier, you may have had elective or medically necessary surgery, and you know, they're literally cutting through your vasculature and your tissue, and sometimes for various reasons those surgical wounds may not be healing fast enough or at all, and then you're at a greater risk for infection. And so we want to get those surgical wounds healed up as quickly as possible. And then you have some wounds that you might not recognize are actually wounds, And this can happen in the neurological realm. For example, the neurons, the myelin sheathing around the neurons starts to break down when you have MS. And the breakdown of those myelin sheathing around the nerves causes them to misfire. And this causes all sorts of issues: cognitive, balance, fatigue, various issues when the nerves are misfiring. So when you're talking about non-healing wounds, talking about chronic wounds, you really have to not delay any further and get some advanced care for those wounds. If you want to know more about these types of wounds, just stay with us in our Beacon of Hope series. We're going to dive into each one of them. We'll get in depth, probably maybe a little more than you want to know, but it's important for you to understand what's going on in order for you to get the care that you need. So we will talk about what Wound Care St. Augustine can do for you, but also, even if you're not going to Wound Care St. Augustine, go somewhere. Get started on getting those wounds healed. Don't delay any further. They're not going to heal on their own after a certain period of time. So, and if you don't get help, then that can lead to greater issues down the road. So let's get on it. Let's get these things healed up for you, and stay tuned.